Perkins and I'm an endocrinologist. Today I will be discussing diabetes. I'll begin with the history of diabetes. It was first mentioned in the 3rd century by Apollonius of Memphis. In the 5th century they were able to differentiate between the two different types of diabetes. In 1921, two scientists, Charles Best and Frederick Banting, took healthy islet cells and implanted them into a diabetic dog, which reversed the symptoms and aided in what we know now today as insulin. In 1922, the first human subject was Leonard, a 14-year-old boy who was diagnosed with type 1 diabetes. He was injected with insulin and was able to live another 13 years before passing away from pneumonia. Moving on to the system's impact, we have the endocrine system. However, if diabetes is left untreated, it will affect all body systems. The main organ involved is the pancreas. The main function of the pancreas is to produce the hormone insulin, though there are many other endocrine organs such as the thyroid, the adrenal glands, and reproductive organs that produce hormones that keep the body functioning properly. Alrighty, so what is diabetes? It is the chronic condition characterized by either little to no insulin production or when the body is unable to effectively use the insulin produced. There are 3 types of diabetes: type 1, type 2, and gestational diabetes. Okay, so diving more into the 3 types, let's start with type 1 diabetes. Type 1 is where the immune system destroys beta cells, which are the cells that produce the hormone insulin. This is also known as juvenile diabetes due to most being diagnosed in children. There is no known cause, only links to genetics and family history. Moving on to type 2 diabetes, it is more prevalent in adults but is slowly becoming common in children due to the rise of obesity. And the cause is also unknown but is more linked to overweight patients, and type 2 diabetes is when the body becomes insulin resistant, so the insulin produced essentially doesn't work anymore. Moving on to gestational diabetes is the last kind we have, and it is only seen in pregnant patients. It occurs when the placenta produces excess glucose that the pancreas cannot produce enough insulin to maintain a proper blood sugar, so it causes diabetes. In this picture, we can see how type 1 diabetes works. Here's the immune system attacking the beta cells and prohibiting insulin production, creating more glucose produced in the blood. Okay, so some signs and symptoms of diabetes are polyuria, which is frequent urination, polydipsia, which is increased thirst, increased appetite, weakness and fatigue, and then low blood sugar, well obviously blood pressure, blood temp. It is more common in type 1 diabetes. Here we have treatment and prevention. As of right now, there is no known way to prevent diabetes. All I can say is live a healthy lifestyle with exercise and proper diet. Treatments vary depending on type and severity. One option typically used in type 2 patients would be the medication metformin, which makes the body less resistant to insulin. Some side effects include nausea and diarrhea. The 2 main treatments for type 1 patients include the insulin pump and injections. The injections are done manually and basically inject the insulin into the body. The side effects include itchy skin and hypoglycemia, which is low blood sugar. The pump essentially does the same thing, yet it's connected to the body that releases small doses of insulin throughout the day and can be managed easier than injections. So this one here is the injections, and this one here is the pump. This is it's small and it can fit in a pocket. So life expectancy. Life expectancy is only cut down for 20 years for type 1 and then 10 years for type 2. But daily living, those with diabetes should regularly monitor their blood sugar, they should eat healthy and exercise regularly. And then they work closely with a team of doctors dedicated to work with their diabetes and their symptoms, and then like future issues they may have, like blindness. Some global statistics are that there are 425 billion people with diabetes in the world, which is a lot. And then one of the major diabetes causes kidney failure, stroke, blindness, and lower limb amputation, which is a huge deal. And then 1 out of 3 people are pre-diabetic, and 90% of those people don't know, so they could eventually develop diabetes. Some current research, well, since there's no cure, there's always research being conducted, such as the artificial pancreas, which was made to automatically adjust blood sugar in type 1 patients. So this is like the prototype thing. So my case study, it was done over Ivy Green, a 47-year-old Hispanic female who I diagnosed with type 2 diabetes. Okay, so day 1, she walks into my clinic with a 2-week history of polyuria, polydipsia, increased fatigue, appetite, slight weight loss of 10 pounds, and a black rash on her neck. So I take her physical exam, and it showed her with a BP of 152/88, a heart rate of 92 beats per minute, respiration of 18 breaths per minute, and she weighed 320 pounds, and she had a body temp of 97.8 degrees. She also had a family history with her father being diagnosed with type 2 diabetes at age 53. There are other things in her family history, but this is the one I found most prevalent. Okay, so the tests I ordered on day 1. I began by ordering a random plasma glucose test by finger stick, which is this, and it only took 1 to 2 minutes. The results were 324 after she ate 2 hours ago. However, the normal range would be 140 or below after fasting for 2 hours. After those results, I then ordered a urinalysis, which is a simple test where a special paper is dipped into the patient's urine and would turn a specific color depending on the level of glucose in it, and that came back with a glucose greater than 1,000 in about 5 minutes. So after finding the glucose in the urine, I put IV on metformin, the medicine I talked about earlier, with 1,000 milligrams by mouth 2 times a day in the morning and at night. I also gave the patient a glucometer, which is this thing again, so she can check her blood sugar and other supplies, and I told her to record it in her log for a follow-up appointment in 2 weeks. The last thing I did on day 1, I made her appointment for the morning of tomorrow so I could send for more labs and confirm my diagnosis of type 2 diabetes. So beginning of day 2, she came back after fasting for 8 hours overnight, and I began by ordering A1C, a blood test reflecting average blood sugar for the past 3 months, which came back with the results of a 7.0% confirming my diagnosis. So basically, a normal would be below 5.7%, prediabetes is 5.7 to 6.4, and diabetes is 6.5% or above what she was. So I'm going to keep on the medicine from yesterday and tell her to continue the blood glucose log, also add some lifestyle changes such as dieting and exercising regularly. I then also referred her to a diabetic education, which could be done by many different people depending on the community you're in. For example, a dietitian and a nurse could explain diet and how to take blood sugar and everything like that. 2 weeks later, when Ivy comes back, I can tell her glucose levels have decreased and she was doing much better. They went from 324 to around 190, 194. So I'm going to continue her on medication since she does not need a lot of insulin. She should live a relatively normal life, and if she continues to do lifestyle changes and take her medicine. So these are my sources. Thanks for watching, Miss Morale, and that's it.